वाराणसी की आध्यात्मिक नगरी में मैं आर्टेमिस हॉस्पिटल एवं उनकी टीम, विशेष रूप से डॉक्टर विपुल गुप्ता, लाइका की टीम, उपस्थित सभी सदस्यों का मैं वाराणसी न्यूरो सोसाइटी की तरफ से हार्दिक अभिनंदन करता हूं। आज की शाम हम लोग सौभाग्यशाली हैं कि हमारे पास हमारे बीच में डॉक्टर विपुल गुप्ता मौजूद हैं, जो हमारे मुख्य अतिथि हैं। आज की सीएमई का स्टार्ट हम सबसे पहले डॉक्टर ओपी यादव को मैं इसके लिए इन्वाइट करूंगा कि वो आए और सीएमई का शुरुआत करें।
Today I am going to present a rare case of pediatric cerebral aneurysm with SDH. I think once again we will, at the end of the session, we will again try to evaluate whether this is actually a rare case or not, because so many studies are there. They actually quote this case means pediatric cerebral aneurysm with SDH means atraumatic or acute subdural hematoma to be in a rare entity.
The topic of today's presentation is maximizing resection of an eloquent cortex lesion using state-of-the-art operative agents. This young patient was referred to us from Buxar, Bihar by local healthcare center with chief complaints of headache for 5 months, seizure for 4 months, and progressive hemiparesis on right side for 15 days. The patient was apparently well around 5 months back when he noticed a holocranial headache whose intensity and frequency both increased over the period of time. Initially the headache days were 1 to 2 per week. It increased to 5 to 7 holocranial headache days per week. The intensity was initially mild to moderate, which became moderate to severe, and patient has to use medications to get relief of his pain.
डॉक्टर धन्वंतरी शुक्ला को भी इनवाइट करूंगा कि उस सर के बारे में सभागार में उपस्थित हमारे जूनियर वाराणसी क्लब के सदस्यों को अवगत कराएं।
Dr. Vipul Gupta's name is not unknown in the world of medical science per se. He is a pioneering figure in the field of interventional neurology. Dr. Vipul Gupta has done his postgraduate program from Safdarjung Hospital after completing his MBBS from Maulana Azad Medical College, New Delhi, and then he has trained in interventional neurology from All India Institute of Medical Sciences, New Delhi, where he has also worked as associate professor till 2005. Apart from his training in India, Sir has took his training from state-of-the-art institutes throughout the world. He has completed his fellowship from Foundation Rothschild Paris and Cleveland Clinic USA, and he has also served as visiting professor in UMass General Hospital, Boston, USA. He has more than 45 publications in journals and 7 chapters in books to his credit, and he has done more than 40 abstract and paper presentations in Indian and international conferences. He was awarded with IMA Award in 2006, IMA Academy of Medical Specialties Award in 2007, and he has also featured in Hindustan Times as one of the top 10 young surgeons in the country. Prior to joining Artemis, which he represents now, he has worked as head of interventional neuroradiology in Max Institute of Neurosciences till 2009, and he has headed interventional neuroradiology department of Medanta, the Medicity till May 2016. Regarding his work, you name a procedure in interventional neurology and Sir is an expert in it. In fact, he will be presenting his work, whatever work he and his team at Artemis has been doing. So on behalf of all the members of Varanasi Neurointervention Society, sir, I welcome you to this holy city, and please, sir, come on stage and deliver your lecture, sir. Thank you.
It has been a pleasure to be in the holy city, and I was talking before the meeting started how dramatic a change it has gone, and so tomorrow morning I'm planning to visit the holy spots as well, hopefully. Now coming to the top, so all of us have heard about neurointervention, aneurysms, AVM, carotids and intracranial stenosis, acute stroke. But how do we achieve, the challenge here has been, how do we achieve high degree of safety as well as high degree of efficacy? And that is where our focus has been for last few years. So I'll start from what still has been my major passion and still a large amount of work, which is aneurysms. Now why? Because coiling is very nice, very safe, very effective and safe, but the challenge has been recurrent with coilings. Flow diverters has been a huge boon for large IC aneurysms, but how to achieve lower complications? Stent assist bifurcation flow diverters don't work so well. We have been using stents, but how do you protect multiple branches in bifurcations? How do we use this kind of metallic device of stents of flow diverting very dysplastic arteries and maintain the patency of the artery in the longer run? And distal, yes, Steve? Okay, and distal vessel reconstruction, can we do that? And what about antiplatelet when we place stent and flow diverters in these patients? Coming to the aneurysm, ruptured aneurysms, even now balloon assisted coiling remains the mainstay, and we are able to place modern balloons in very angulated arteries, and the focus is on complete restriction. I'm not going to detail, just show you one case. This is an old lady with middle cerebral artery bifurcation aneurysm, and what you can see, this is the M1, this is one part of the M2. This is 1, this is 3. It is a trifurcation. Lobule is a very diseased. You can see all the arteries coming from the aneurysm, and in the past one would consider not amenable to endovascular at all and all. But still, I think balloon assisted coiling done well, when you know how to realize 3D using biplane labs, we can try to reconstruct this kind of aneurysm as well. Here, venous stenosis of bilateral sinus. You have to treat just one sinus here. So we do transvenous angioplasty, stent placement, and the sinus recanalized. I don't have the pictures, but our fall of her papilledema also regressed, and she did pretty well. So that's the last slide of the talk, and I thank you for your patient hearing.
Today I'm here to share the insights of our products and how they might align with your needs. Leica Microsystem is an 170-year-old organization, and we are truly grateful and humble for the appreciation we have received over the years from the industry leaders in across divisions of life sciences, industry and forensics education, and surgical microscopy.
Now it's time to felicitate the speakers and other guests of today. So first we'll felicitate all the speakers one by one, and after that the office bearers of our society who are present today.